Hey Refam, my name's Kate and welcome for the very first time to My Surgeon Says. We've had a bit of a facelift ourselves, so if this has popped up on your podcast feed and you have no idea what's happening, the podcast formerly known as Keeping It Real has had a rebrand to a new name, a new look and a slightly different format. We will, of course, be keeping true to our plastic surgery roots, covering topics from explaining what to expect as a cosmetics patient to answering hyper niche surgery specific questions you wouldn't even know to ask. But we'll also be broadening our horizons. We'll be inviting guests on to chat about all kinds of things, from how to style your new post-op body, nutrition tips to prepare and recover from surgery, as well as other medical professionals to give us a peek into their corner of the surgical world. If there's a topic you'd like us to cover or a guest you're desperate to hear from, then send us a DM or a voice memo over at our new Instagram at MySurgeonSays, all one word, no gaps, and we might even feature you on the next podcast. So introductions aside, we're kicking off this week with a chatty episode from Richard and Kim, so you can learn more about their humble beginnings in an office the size of a closet, where Kim has done her weirdest marathon, and how Richard may have saved his driving instructor's life with his plastic surgery knowledge. As always, please rate and review us wherever you're listening to this, so that other people can find our little podcast and I can justify the rebrand to the big bosses. Okay, enjoy. You guys have been in the biz a long time. What have been the biggest changes you've seen in that time to plastic surgery?
Subspecialisation. I think focusing on being really good at a smaller niche area. A lot of technique things it's nuanced. So like just finessing little things rather than big changes.
It's no longer massive inventions, it's refining what kind of already exists.
And even things like breast implants, like the implants that we use most of the time have been around more than 30 years now, and the mentor implants haven't changed them at all. There's a couple other players who've come on board, but they're really essentially the same thing. So
some of the advances in other surgeries like keyhole surgery, which has that's really relatively new, and then robotics. So none of them are really applicable to plastic surgery. So we've had, I'd say, more technique modifications rather than drastic changes.
Speaking of drastic changes, all of your patients that come out the other side, some of them have very drastic transformations. Is there anybody that sticks in your head as whether it be like a personal journey or just like aesthetics wise that's really stuck with you?
She has featured on our social medias over the years. It's a patient who she came in, she had lost a lot of weight but wasn't really at her goal weight. And I've ended up operating on, if she's listening, she'll probably know who she is, but I've ended up operating on pretty much every part of her body. And when I look at her before and after photos now, it's hard to believe that it is the same person. A lot of it's come down to her hard work because she's continued to lose weight. But, I've done an upper back lift, a body lift, brachioplasty, breast implants, breast lift. There's not many other areas left. Yeah, probably she would be the one that sticks in my mind as the most dramatic change.
Yeah, I agree. Whilst a breast reduction is extremely dramatic, and those patients, one operation and done, and are very, very happy as well. But it's the weight loss patients that you go, you've been on a journey with her for a number of years. I would have a handful of patients, a similar sort of thing, maybe not quite as many procedures, but yeah, and that sort of planning, you meet them for the very first time and you come up with a plan and they're like, well, look, I'm just going to do this one procedure this year and then I'm going to wait and do breasts later and my arms after that. So get to know each other very well, and we're in for the journey and the long haul and get them out the end. And it's kind of weird, that last kind of like, not break up, but they're kind of like, do I not have to come and see you again? It's like, well, you're welcome to, but there's nothing really left much more that we can do. Come and have a coffee sometime in the office.
It can be a little bit of emotional, like Kim just described as a breakup, but it kind of does sometimes feel a bit like a breakup.
And the worst kind because no one's done anything wrong. So
Yeah, exactly.
Everyone's done
Yeah, it's
everything
kind of
wrong.
like, do I not have to see you? Like, don't I just have to come in every year? Like, not really.
All right, more personal.
Oh, no.
What do you guys like doing outside of work?
Work.
That is the truest answer of the day.
I meant it as a joke, but I think it's true.
You do have other
Awkward.
things that you enjoy.
I've got a list.
Yeah.
Running.
Last year,
Last
you
year
did
I
a
did
full
a full
marathon.
marathon. I've just done another half and plan to do the full again later in the year. Travel, it's kind of wanky because everyone just says travel. Photography, I enjoy photography, so I've always been interested in that. And then my dog. Had to mention the dog.
Oh, poor Lucia.
Kids, Lisa.
Okay,
In that order.
yeah. I'm
Pretty much.
Lucia,
Lisa
Lucia
doesn't
running,
listen to the
come on.
podcast, so it's okay.
Yeah.
Lucia does, though.
Yeah,
I
she
know
does.
Lucia listens to the podcast. She never misses one.
For those that don't know, Lucia is
A Legato, Romignolo,
dog.
superstar sniffer.
Yeah.
Oh, like I can't even possibly top that. I also like to exercise. Triathlon's more my thing, so not a great runner. So you have to mix it up with a couple of other sports that I'm not
Most people
great
say
at
they're
as
not
well.
a great runner. Typically, don't run.
Swim and bike and, have a love-hate relationship with running. And it's a great way to see the world. And I have done half marathons and a couple of marathons in weird places as well.
What's your
Weirdest one. Come on.
Weirdest one, half marathon in North Korea.
Yes, I think that was the weirdest.
Probably the second weirdest would be a marathon in the mountains of Mongolia.
Whilst drinking.
No, that was
France.
not the drink. Bordeaux, like the.
But just so everyone is clear, you did a marathon in France
Yes,
and there were drinking stations, but not with Gatorade.
correct. With red wine, Bordeaux red wine, like
And how long did it take?
delicious. Oh, I beat the cut-off time. There was also
2 weeks.
oysters, steak, cheese.
Perfect for someone who doesn't enjoy running.
And doesn't mind a glass of red wine. Beautiful scenery. It's called Marathon de Médoc. If anyone's interested, is actually one of the most fun events. There's a theme every year. You get dressed up.
Do you have to do the marathon? Can you do anything less than that?
Oh, yeah, you can pull my friend actually had been injured, so it's like a figure of 8 loops. So you go back through the main town. So she did half.
Yeah.
And then got to drink a little bit more at the finish line while we were still running the back end.
Nice.
I also done a half marathon in Greenland, so special spikes to go on your shoes, so on the actual ice cap. Yeah.
Cool.
So, yeah, there's lots of fun places that you can go and do weird and wonderful things. And a triathlon in China as well.
You're also a bit of a foodie. More of a foodie than me.
Yeah, I do like to explore nice restaurants in Melbourne as well as travel interesting places. Probably the country with the worst food, and I would never recommend going there for the food. Mongolia.
Wow.
By
Wow,
hands
what a
down.
surprise.
God, so
you
all
like
our
mutton?
Mongolian listeners.
If you
Was
like
that one on my list?
20-year-old sheep and fatty and yak milk and disgusting.
All right.
Nothing good about anything there.
Note to self, don't go
Don't
to
go to
Mongolia.
Mongolia.
Hey guys, we're ruining our international market. Were either of your families in the medical industry?
My immediate family, no one went to, I was the first person to university. I don't want to give the academic credentials of too many people, but certainly no one went to university. And so definitely no medical. They were all, my father's side family, all in fashion, so women's clothing. So I'm probably closest what I've ended up doing in line to that. And mother's side was in the electricals business. I probably inherited a bit of that because I do like my gadgets. They were sort of the JB hi-fi of the day. So for some of the older folk out there, Maxwell's the Price Strippers. That was there was
And they
Maxwell's.
rebranded that. That's crazy.
So, yeah, definitely no medical.
Yeah, right.
I've got an uncle who's a dentist. Does that count?
Yeah,
Me too.
Not the same.
I don't think we were related, but yeah, I've got pretty much no one. There was some university degrees prior to me, my mum, but not my father. And I have an uncle he was an oral surgeon. And so he did dental training and not medical school, but had specialist training to do more surgical things in the mouth. But he had really no influence on me. And I've got one cousin who was at medical school a couple of years ahead of me. But yeah, definitely not a medical family either.
What do you guys think your why is, like the why you do what you do?
I think it's incredibly rewarding, and I feel a great honour actually to have patients come in and trust, one, to actually tell me what their insecurities or their concerns are, two, to then take their clothes off and show you that bit, and then three, to actually trust you enough to operate on them. Like it's a big commitment, and sometimes, because we operate, not all day, every day, but it's like sometimes when you get asked that question, you have to think about it. And other people, when you first meet, they're like, oh God, is it not scary doing surgery every day? And I'm like, no, you just become an expert at what you do. But when you sort of take that little step back and think, what are we actually doing? It's amazing. And the vast majority of patients are extremely happy.
Yeah, I think similar to Kim. I mean, I think being in a very privileged position of being able to help people, and that's taken different forms over my career, but we're very lucky to have been trained and have the skills to be able to improve people's lives and address issues for them. I think the other thing that I really enjoy is just the challenge of surgery. So always striving to be better, always looking for improvements. Even if something goes perfectly well, looking at it critically and trying to do better. That's something sort of I enjoy. I mean, it's not just in medicine, but I think medicine allows me to really be part of my career in trying to do things better, which you maybe don't sort of have that opportunity in a lot of other careers.
Speaking further to that, like you get a bit lost in the weeds when you're just doing it every day, and you probably get like very desensitized to what you're doing. Is there anything that you remember telling somebody outside of the medical industry that you just take as like everyday stuff that they thought was like a bit wild?
Everything. Seriously, everything. I can just describe a typical day and it blows people's socks off, literally. Some people it's too gory for, and you start explaining, go, I don't want to hear. That's my mum. But just what for us seems like a very garden variety day is things that people can't even comprehend, like even, a breast reduction. To try and explain that to a lay person who hasn't been thinking about it, it's a very unique skill set.
But even within the medical profession, so we have various staff that work with us at all times essentially, but even in theatre, if it's an anaesthetist or a nurse that has never seen a breast reduction for example, they will literally see what we've done. We pull it apart, take away a lot of it, and then you put in usually 2 sutures, and then you can see this sort of relief on their face. They're kind of like, someone, if you've never worked with them, they haven't seen that before, if they say there's a medical student or nursing student in their theatre, and they just be like, oh, and they can see how it's coming back together again. And not uncommon for them to say, look, oh my God, I thought you had no idea what you were doing, and I thought there's no way you're going to make that look like a breast at the end of the operation. And wow, you have.
That's what I thought when I first saw one.
I was going to say that's what you thought when you saw me doing one. But yeah, it is a different sort of thing in a lot of the procedures that we do.
It's also unique amongst pretty much all surgery, in that there's a visible difference. Or there should be a visible difference
immediately
at the end of the case to the start of the case. So if you compare it to orthopedics and they're doing a hip replacement, the patient looks identical when they get wheeled in to when they get wheeled out. If you take out someone's appendix, they look identical before and after. When we're doing any procedure, even as they're coming off the table, it can be sort of such a dramatic change that's very, very satisfying. And it sort of goes along with what Kim's saying. It can be very rewarding for the staff in theatre as well, because they see that transformation as well.
And the other cool thing on that with the breast reduction is we generally do one side and have that mostly finished before you start on the other side. And we have to walk around the feet of the patient on the bed of the table, and you kind of walk around and be like, oh yeah, there's one that's perky and sitting up, and the other one's hanging off the side of the operating table. It's oh yeah, I've made quite a big difference already. Just on half of this patient, I've got to match it still, the challenge on the second side. But yeah, to have that immediate result that you can see,
I'm sure the answer is no, because why would you have become a surgeon? But were either of you ever like squeamish at the beginning and you've kind of become less so?
No.
Yeah, me either. Even when I'm telling stories to my friends and they start going, I'm like, oh, grow up.
There's some things that I don't love to deal with, like
Yeah.
having to deal with saliva all the time. I'd be like, when they pull out the breathing tube and it's got all the like sticky bits. And I don't love that, but I just don't have to be a part of that. But blood and pus and
I mean, I remember when, at anatomy school when we were doing cadaver dissections. I remember one student hitting the ground when they first got revealed.
Really?
Oh yeah. But
the
no,
smell is never good at those.
well,
places,
no
though,
sense
really,
of smell, so it doesn't matter.
Yeah, like,
How early in the medical process are you doing anatomy school?
Year one.
So like of medicine.
yeah, they do.
They had
They
time to
take you
drop
in.
out. Okay, I was just making
But
yeah.
weirdly. So
Yeah.
I can go into theatre, see anything, doesn't gross me out, never feel nauseated, don't feel sick. But if I'm watching a movie or TV and there's blood, I get really
As if.
eked out. Yeah.
What? So funny.
Very uncomfortable.
Is that because you're criticising them? They're doing it wrong.
No, like,
The
you know,
blood.
you can't watch horror movies. I wouldn't watch them. But,
A
if
horror
there's...
movie's a bit different though, because
No, but like even if there's
scary.
violence and blood on
that's
I can't,
weird.
I get all squeamish.
Do people act differently when they find out what you do for a living?
Yes. Yeah.
Go on.
I don't know if you get it the same, like, I think just being a female. There's a guy, hopefully he doesn't listen to the podcast, in my triathlon club who had a medical issue, not my area of expertise whatsoever. But it's like, I still went to medical school. I still understand a lot of medical things. And he was like, oh, yeah, you would understand about my lung because you're a nurse. And I was like, and I'm like, no, actually, I'm a surgeon.
Nurse surgeon.
But and he was like, yeah, the same thing. And I was just kind of like, okay, yeah, we'll just leave it at that. I know I should be more just be like, what do you do for a job? I'm a plastic surgeon. Like, and sometimes I will say that, but sometimes I'm like, I work in a hospital, and then you kind of have to drag it out because then it's like the switch, and then depending what or where or who, immediately people will be like, oh, I've always wanted, like, what about the fat on the front of my armpits, and what do you think about my face, and what about my nose? And I'm just like, I hate a social conversation going down that path because I'm not out looking at every single person that I meet thinking, oh, this is an operation I can do on you.
I
I was just about to say, well, because that would be psychotic.
I totally do.
And
Sorry.
if you're in a restaurant and someone walks past with like double H cup boobs, you're kind of like, oh yeah, like
So
drop
you
off
do
your card. I
do
could
it.
probably help her, but I'm not sitting there every person near me. And it's like, when you meet someone that's a lawyer, you don't suddenly go, oh, can I just have a chat with you about my will? Or
Richard, do people act differently when you say it?
Well, hard to gauge. I think they're always generally interested. I think it's an interesting profession. A lot of people sort of have a lot of misconceptions maybe about it. So mostly when you say that you're a plastic surgeon, they think that you do cosmetics, which is fine for me because that's what I do.
but they do kind of think that all you do is breast augmentation. And when we say, oh, like I do breast reduction and cut off skin on patients that have lost a lot of weight, they're just like, like, you can see that switch is kind of like, oh, you do some good as well as like just the totally unnecessary.
But yeah, I mean, they generally don't think you're doing skin cancers and things like that. Not a bad conversation starter. Just slope
And then
off.
you start handing out your cards because you've already
Well, now I've
decided
got a
what
digital card.
what
so I
operation
hand
they
out that.
need.
He's like, thank you so much for asking. Your brow. Take this from a professional.
You have
I have had that
wasn't
conversation.
it wasn't it your motorbike guy when you were doing
Oh,
your
yeah.
motorbike
Well, that was
license, and he had a
skin
skin
cancer.
cancer, and
Yeah.
he was like, mate, thanks for teaching me how to ride my
I think that's a
Vespa,
melanoma on your neck.
but I think you need to
Was it?
deal with it.
Next week I was cutting it out.
Well, that one's for the best. A lot better than
Yeah.
Could do Botox.
While you're there, maybe you need a facelift as well.
Yeah.
What does success look like for you now, and has it changed over your career?
Success is, for me personally, is just being busy and doing the operations I want to do, and then more broadly having Ree as successful, Kim being busy, having our doctors who do injectables busy, having all the staff happy. I take a lot of pride in all of our social media content and all the work that you do. So I enjoy all of that as well. So all of that together is success. Like if I just had one piece of that, if I just had the social media and no operating, that wouldn't be so good.
Do you think what you're doing now is what you envisioned when you started out?
No way. No way. It's like, it's completely different. So I think it's become sort of more of a blend of sort of medicine, surgery and business, which has been a good mix for me than probably when I first started. Like I didn't sort of really consider the business side of things. So yeah, I mean, when we joked before, when I'm not at work, I'm working, and I honestly am. Like I often sort of thinking about how we can do things better and improve our services. But yeah, nothing like I thought I'd just be cutting out skin cancers or doing something like that.
And I'm eternally grateful for Richard's love of the business side of things, because it wouldn't run without you doing that. Yeah, I think happy patients, happy staff, walking in the door of the office and feeling at ease, not like, I've got to go to work today, like it's horrible. And it doesn't feel like a doctor's practice. It doesn't feel clinical. It feels calm and a nice environment. And that's sort of what we want to nurture for the staff and for all of our patients.
I think as well, because when you're doing medicine, it's just like getting into uni is so hard, getting into medical school is so hard, getting your placements is almost impossible. You're kind of always striving to just get to that next stage. So to even be able to envisage doing something like this, because I can't even imagine, like you don't have any space for it when you're like, God, I just have to be like in the top 5 in the state to be able to get a placement.
You know, even when we were starting as plastic surgeons, like you were joking now that, I think on the Tavakoli podcast joking about, you know, the yellow pages and the white pages ads, like that, doing this was never a thing.
I actually bumped into a plastic surgeon who I leased space off when I first started back in 2003. He was like a very good surgeon and lovely guy, but it made me think back to those days, and to call it humble beginnings would be an overstatement. I remember being pretty much like consulting out of a cupboard. I remember our IT guy having to go under the desk. Like I had one computer under a desk and nothing like what
good for podcasting though. Good for the sound reverb. Small.
Yeah, maybe it was small. All right.
We had a small movement back to those sort of times while these rooms were getting built. That we were.
Yeah. Well, they were more upmarket than where I started. They were not upmarket.
Fancy about where we were then.
All right, guys. Thanks so much.
Thanks for having us.
Thank you.
Done.
If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.